Dr. Vikki Petersen here. Today I want to talk about a topic that is very related to gluten. It can be a little bit of a tough topic to discuss, especially with those who are going through it, and that is infertility, abortion, spontaneous abortion that occurs, but different gynecological and obstetric problems. Infertility affects 1 in 6 couples in this country, and you might know someone who's been through it. It can be very, very expensive, and not to mention emotionally draining. And the gluten association is very strong. So normally I'm speaking to you about my clinical experience and definitely throwing in some research, but today there's some very specific studies that I'm going to be talking about, so excuse me if my eye wanders a little bit. I actually am reading from some notes so that I'm quoting correctly these studies. Now, the actual reference for those who are more scientific and want to know exactly the journals that these came from and the exact date, they're actually in my blog that I'm posting today as well. So you can look on Gluten Sensitivity and Infertility at glutendoctors.blogspot.com, and the full information is there, but I wanted to put it in this format as well because it's definitely something that I'm asked about frequently. So starting in 2001, what a study showed was that untreated celiac, so people who had celiac but didn't know it, of course, as we know, that's a huge problem. We diagnose a very limited percentage of the celiacs in this country. So they found that untreated celiacs for women was associated with a delayed onset of the period, earlier menopause, increased miscarriage rate, and lowered birth weight. That makes sense as far as the lowered birth weight because women with celiac or gluten sensitivity are not absorbing nutrients as well as they should, which might be the bottom line with all of these problems, but it certainly makes sense with a lowered birth weight. Now, what their conclusions were was that a gluten-free diet would decrease the risk of miscarriage, increase the nutritional support to the fetus, and actually improve the overall outcome of the pregnancy and the perinatal period, which is including the first month of life and the pregnancy itself. So that was a great study that was pretty unequivocal in its support for making sure you get off gluten if you need to. Now in 1996, so prior to this 2001 study, they found the same results, the delayed onset of the period and the earlier menopause and increased miscarriage rate. But what I liked, the addition, the information that's different than what I just said in this 1996 study was their conclusion. So their conclusion was that patients who adhere to a gluten-free diet have a gynecological and obstetrical history that is indistinguishable from the control group, meaning the healthy, normal woman who had no gynecological problems, no obstetrical problems to speak of. So they found that getting these people on a gluten-free diet, these celiacs and gluten-intolerant women, handled all the problems. They no longer were at risk for not having their periods when they should, and earlier menopause, and lowered fetal birth weight, and increased miscarriage. All those things went away. So that was pretty exciting. Now, recently, more recently, in 2002, another study, their conclusion was that tests for celiac should be done for any woman at risk for a spontaneous abortion. So this was a different study. These were looking at women who were having miscarriages and spontaneous abortions, and their conclusion was that any woman who's in this category has had a miscarriage or has had a spontaneous abortion, she should absolutely be checked for gluten intolerance. So that was another study that was very definitive. And last but certainly not least, just last month, so this study I saw online, it hasn't even officially been published yet, it's about to be, but it was being shown online. May 2010 study was looking at a 30-year-old woman who was infertile, and she was diagnosed with celiac, and then 8 months after being diagnosed and put on a gluten-free diet, she conceived and did very well in her pregnancy. So this was a woman chronically infertile, could not find a cause, got her off gluten, and she conceived successfully in just 8 months after being on a gluten-free diet. Their conclusion was that gluten intolerance should be checked for in all infertile women, as changing their diet, and I love this line, so this was a direct quote from the study. They said changing their diet can solve their fertility problem. So there you have it, a tremendous amount of research supporting that gluten can cause infertility, miscarriage, etc. So if this affects you, I'm glad you heard about this information. If it's not affecting you, you doubtless know someone who has this problem, even a younger woman who's having gynecological issues, trouble with her periods, etc. These women need to be checked for gluten intolerance. So please spread the word. I hope this helps and you found it informative. And until next time, I wish you very good health.